Dr. Olusola, thank you so much for joining us on Health Connection. Good to have you again. The title of our segment, Celiac Disease, Crazy New Fad or Serious Condition. So let's get started here with this. We hear a lot in the media about gluten and celiac disease, but not long ago we didn't hear anything about either. So with a definition, what is gluten?
Gluten is a protein that's found in wheat, barley, and rye particularly, which are in a lot of the foods we eat on a regular daily basis.
What is celiac disease and how serious is it?
Celiac disease is what's considered an autoimmune disease that when people make antibodies to gluten that's in our diet, and that antibody then attacks the small intestine, causing it to not be able to absorb certain nutrients through our diet.
A few years ago, most people had never heard of gluten. They had never heard of celiac disease. Where did these come from?
Well, it's become very popular. Obviously, celiac disease is actually can be a fairly serious illness and cause a lot of problems. And but the symptoms are very difficult to diagnose. A lot of the symptoms are very vague, and so it's very difficult to diagnose. So as we become more familiar with it, we're diagnosing more and more people with it. There's also something called gluten sensitivity, which patients have symptoms because of gluten in their diet, but they don't necessarily have the antibodies or the autoimmune disease and the malabsorption.
What are the symptoms of celiac disease? What are we looking for?
The symptoms are all over the place. A lot of times they are gastrointestinal type symptoms, such as abdominal pain, constipation, it could be diarrhea, it could be gas and bloating, but it could be things as vague as fatigue, or there's other things like rashes and other types of symptoms that could be related to celiac disease.
Since there's been a lot of talk about celiac disease in the media, and you hear people are pursuing gluten-free diets, and you see menus in restaurants gluten-free, is there a heightened sensitivity to the disease, or is it really on the rise?
I think a little bit of both. We are diagnosing it more and more because as patients come in with these vague symptoms, we're starting to think more about it. We're testing more people, so therefore we are diagnosing it a little bit more. But there are certain people who don't truly have celiac disease, who just have gluten sensitivity and have some symptoms when they eat gluten products, and therefore their symptoms improve when they avoid gluten.
Are there factors that can increase your risk for developing celiac disease?
The biggest factor is a family history. So if you have a family member who has celiac disease or gluten sensitivity, you have about a 10% chance of getting it. And there are certain genotypes and certain genes that we can test for that do put you at increased risk. Other autoimmune disorders such as type 1 diabetes, certain types of thyroid disorders, rheumatoid arthritis also have an increased risk.
What are the symptoms for intolerance to gluten? We talked on this, symptoms for intolerance to gluten, and are they different in children and adults?
Well, the thing that we sometimes see, so the symptoms of GI issues, abdominal pain, bloating, constipation, diarrhea, can be similar in children as well as adults. The things that we sometimes see in children are related to the malnutrition, where they can have growth delays or losing weight or not gaining weight appropriately.
How do you've touched on this, how do you diagnose celiac disease?
Well, the first step is usually to do blood tests, and you can do blood tests looking for the antibodies to gluten in the bloodstream. You can also do the genetic test and look for those genetic markers, which should be positive in patients who have true celiac disease. The gold standard test is actually to do an intestinal biopsy of the small intestine by an endoscopic procedure.
Is celiac disease treated with medication, managed with diet, combination of both?
There's no medications that can help celiac disease. It's completely controlled with diet alone and the gluten-free diet. If you have true celiac disease, you completely have to eliminate gluten from your diet.
I think you've answered the next question. Can it be cured?
The cure is the gluten-free diet, and the changes in the small intestine and the damage that's done because of the antibodies to the gluten can actually be reversed if you stay on a gluten-free diet long enough.
Very well. Doctor, very informative. Thank you.
You're welcome.